Wanted to talk about navigating grief and the mental health pieces behind it, knowing what is normal grief, what's not normal. I don't even know if normal is the best word to use. It's just common, and that there are common ways to grieve, but that everything is really individual. So I just want to explore this because I think it's important for all of us who's been through this type of loss to understand that we're not alone and we're not crazy. But when people are not outwardly talking about this, then it makes us feel like we don't know what's normal and what's not normal and all that. So that's what we're going to dive into today. So here's just some learning objectives about what we're going to go through. So we're going to look at the typical physical and emotional responses to pregnancy and infant loss, looking at common trauma responses, postpartum changes that happen both physically and emotionally, and looking at reaching out for extra support when you need it and how do you do this. So anytime during this webinar, if you guys have something to say, a question, a comment, go ahead and type it in the chat box. That's what I'm going to be looking at right now. And we will answer things. I'll stop and answer questions, but the way it's going to go is I'm going to go ahead and present some information, and then we're going to bring Dr. Rothert on, and we're going to have a little conversation, not on PowerPoint. So it's almost like we're having a coffee date, the two of us and all of you. And then we will, we encourage questions during that time, and then we'll have a more general question and answer time as well. So I just wanted to share a little bit about me first. And I am an occupational therapist by training. I went to USC in Los Angeles. I got my master's and my doctorate from USC at 2 different times. But I really connect to the philosophy and the theory behind occupational therapy, that we believe that every human is a holistic being, and that when we approach anything in health and wellness, that we're not just looking at one aspect of it, but rather looking at the person as a physical being, their emotional, cognitive component, their spiritual component, the environment that they're in. So just looking at lots of different pieces of the human. And then my son Norbert is down in the corner there. So he was stillborn in 2005, and he was my first baby. I was 35 weeks pregnant and went into labor thinking I was just having an early delivery. And it turned out that his heart had stopped beating due to a liver cyst that had burst, and that toxins inside this cyst killed him, but something very random. I entered into a period of time where I just was numb and in shock and didn't really deal with anything. And it wasn't until 9 years later, when my husband Sean made the film Return to Zero, that we started talking about our loss, not only in our community of friends and family, but also more publicly. And I would say for me, I'm a very private person, and that was very hard because it's like the movie is very intimate, and all these little pieces that are between a couple or between family members was very public, and that was hard. But I began sharing my story more publicly and learning that that was really what set me free in terms of not feeling shameful, not feeling alone, that type of stuff. So I've gone on to host women's retreats for bereaved moms who have had pregnancy and infant loss, and that's transitioned into a nonprofit organization, which is Return to Zero Hope. So now we're focusing on that, and then also working with providers to help them get training and support they need to better support families going through this type of loss. So I'm gonna hand it off to Donna Rothert, and she's gonna introduce herself.
Thank you, Kylie. It's
Okay,
good.
I cannot hear you. Hold on.
Oh dear. I am unmuted.
Maybe
and it's
raise your
registering.
volume. Oh, Betsy can hear her? Okay.
Okay. Betsy can hear me. How about you, Kylie?
It's me.
I can take these off and just use the computer.
Okay, they can hear you. I can hear you now. Yeah, good.
Okay, all right. We're doing our best today.
Yeah.
Thank you, Kylie. I wanted to just tell you a little bit about myself. I'm a clinical psychologist in the San Francisco Bay Area, and I've been in practice since 1997. And in 2002, I experienced 2 pregnancy losses. The first was at 22 weeks of pregnancy, and I found out at a routine appointment that my baby had passed away. I was sent to the hospital to have labor induced, and I delivered her the next day. And I did get to see her and to hold her. And later that year, I had a first trimester miscarriage. And those 2 losses were very impactful for me. I'm definitely one of those people who has like a before and after in my life. And among the changes, it led me to want to shift the focus of my practice. And so I then sought out some extra training and began specializing in working with people who had had pregnancy or infant loss. And I've been doing that for about 15 years now. And last year, I wrote a book. That's right there. It's called At a Loss: Finding Your Way After Miscarriage, Stillbirth, or Infant Death. And it is 30 chapters that each have a brief essay on a topic about what it's like to live after loss. So some of them are the feelings like hopelessness, anger, loneliness, which can be a very underappreciated, I think, feeling after loss. Some of the issues that come up for people, from things like talking to people, issues between the couple, returning to work, trying again, and some strategies for coping, as well as just a discussion of what it's like not just to live in the short term, but in the longer term experience after loss. So that's a little bit about me.
So Donna's going to come back and after a few slides that I talk, and we're going to have a conversation. Thanks for being here. And her book is amazing. I love it because it's really easy to read. They're short chapters. It's not overwhelming and very, very practical. I'd say it's my go-to book for the like immediate crisis is Navigating the Unknown, like right there when you're, but Donna's book takes it kind of after you go home and you're entering the world again, and how are you relating to other people and entering work and your partner spouse relationship. So it tackles a lot of different things, but I just love it because it's easy to read, because when you're grieving, you don't have much of an attention span and you cannot focus on anything. So thank you for doing that. Okay, so we're going to just take a deeper look at what grief looks like. So grief, as I said before, is individual. Everyone's going to experience it differently. There's no timeline to grief necessarily, that people will experience it in their own way, in their own time. And sometimes you experience certain things and you go forward and you come back and it just changes. But up here on the slide are some normal grief reactions that are common. They're not everything, it's just some things. We have a more exhaustive list on the Return to Zero Hope website, and I put the link down below that if you wanted to look more into it. But just understanding that grief expresses itself in so many different forms, right? That there's physical grief, emotional grief, cognitive, behavioral, like it it's not just feeling sad. It can go into your body and it can make you exhausted, have headaches, hard time breathing. You can be shock, numb, you can be crying, you can be sad, anxious. It can impact your work performance, your relationship with other people. Maybe you start avoiding places or things or people. So it's not just one thing. It's very, very complicated. And I think that that's important to understand, that there isn't a right or wrong way or for this to come out. It depends on you. So then looking at societal reactions to death. So in our society, I really believe that we have a fear of death. We lack rituals around it. And I'm not saying everybody, but in general, the American society does have these aspects to it. And because we're afraid of it and we don't have a way to deal with it, it becomes taboo. And that a person who's experienced the death of a loved one, other people don't know what to do or don't know what to say. And so they, a lot of times, won't say anything, will avoid the person. And that the person who's grieving is left alone and isolated, right? And there's not a lot of support or guidance from other people. And really, if you've been through it, then you understand and can help someone who has been through it. But if you haven't, you just don't know what to do. And that's, I think some of the times it can be hard dealing when you're the one that's had the loss, dealing with other people, but they don't know what to do. And sometimes it's our job to educate them. But it is a huge, it's huge. It's a societal problem. So just wanted to kind of give a little bit of cultural framing around that. And this is a quote that I love that says, "The reality is that you will grieve forever. You will not get over the loss of a loved one. You will learn to live with it. You will heal and you will rebuild yourself around the loss that you have suffered. You will be whole again, but you will never be the same. Nor should you be the same, nor would you want to." So we've had this experience that is life-changing. As Donna said, it's like there's the before and the after. A lot of times, it's something that just draws the line in the sand. And I'm sorry, I have two cats that are not acting well today. That you are so changed, and sometimes you wish you could go back to who you were before, but you will never be the same person. But who are you now is maybe a more fuller version of you, and you can grow and heal and rebuild yourself. So it's just really beautiful, and I think it gets the reality of a loss and what the impact can have. And then just looking next at common trauma responses. So understanding that the loss of a baby, pregnancy or infancy, is a trauma. And recognizing that, we can look at what are common trauma responses. So these are just some examples: depressed mood, irritability, anger, feelings of insecurity, guilt, low self-worth. Maybe you're having anxiety, you can't breathe, your heart's racing, maybe your stomach. I know sometimes, in the beginning, it was just if I was triggered, I'd be like, I want to throw up. Maybe we're tired, exhausted, or we're just hypervigilant. Maybe we're sleeping too much or too little. Are we gaining weight because we're just eating all the time, or we're not eating at all and we're losing weight? And so again, that this is, individual, but these are some common expressions. I also want to point out that grief and trauma responses overlap a lot. So I don't necessarily feel, and I've talked to others, that it's important to say whether it is grief or trauma, but I think it's just important to identify and be aware of how it is coming out in you. Because a label is a label, and that's not gonna solve the problem. It's just, first of all, becoming aware of how is it expressing itself? What are you experiencing? And here, just looking a little bit more at trauma, are you having flashbacks? Are you having memory loss around the experience? Maybe you're having trouble concentrating, recurring thoughts, you're in a mental fog. Maybe you're having like disconnected from yourself, disconnected from other people. You're avoiding people or places. So like hospitals, pregnant people, babies, just different stuff like that. But again, if you go to the parents section, rtzhope.org/parents, there is a box to choose from that says navigating trauma. And so there's more information about trauma on that page, which I encourage you to take a look at. And then lastly, I want to talk about postpartum changes. So even if your pregnancy didn't end in the birth of a live infant, so a stillbirth, pregnancy loss, termination, or your newborn passed in infancy, everybody, moms, dads, partners, surrogates, adopting parents, have the potential or at risk for developing a perinatal mood disorder after the loss of a child. So understanding that this is not just impacting the birth mother, but everyone else who is considering themselves as a parent. And that's an important thing to be aware of. And then looking at the changes as a result of hormones. So a lot of these are physical changes. And I say this like most of you are probably not in this exact place right now. Some of you could be, but I also think it's important to understand, even looking back, like, oh, these were normal things that no one told me about that were going to happen, that we had to navigate on our own. And it's really hard, right? Like you've lost your baby and you're sent home and you're still having all these physical and emotional manifestations, like as a result of having a baby. So your milk comes in, you may have tender breasts, your uterus is cramping, right? Because it has to go back to the size it was. You were going to have bleeding and spotting, maybe some nausea, vomiting, and then depression, anxiety can come as a result of the hormonal changes. And then perinatal mood disorders and loss. So having a loss puts you at a risk for having a perinatal mood disorder. So just in some of the research that's out there, it's just showing that being a bereaved parent puts you at a higher risk for experiencing depression, postpartum depression, anxiety, and post-traumatic stress disorder. So I think that it's not only after the baby that you lost, but also in subsequent pregnancies. And I just wish someone would have told me that, because I was under the impression that, oh, once my daughter was born, everything was going to be fine. And it was not. It was like there was a lot of grief that came in. It's a trigger to go through a birth again. And I think the unexpectedness of it catches you by surprise as well. So that's just in general looking at grief and trauma and postpartum. And I'm going to stop here for a second and just say, does anyone have any questions that they want to type into the chat box to clarify anything about this particular before we move on? No? Okay. That's okay. Um, okay, where can you find Donna's book? Donna's book is on Amazon. Is that correct?
Thank you. It is on Amazon. It can be ordered in bookstores. It is also available in an electronic version. And it's in a couple of libraries, and I would love to have it in more. When people request it, they're more likely to order it.
And then Donna, somebody's asking, is a perinatal mood disorder a DSM-5 diagnosis?
Well, perinatal mood disorder does not necessarily mean that there's been a baby loss, right?
Correct.
So just to make that clear, there's something called PMADs, which are pregnancy, mood, and anxiety disorders. And there's always been kind of a challenge in figuring out how we end up labeling, categorizing certain things with the DSM. Sometimes there are modifiers for issues like major depression or adjustment disorders. Just to say that there are different ways, maybe depending on what the specific symptoms are, to express what's going on. And many of us always kind of feel it's inadequate. One thing I think is important in general, when we're talking about bereavement, is that it's not pathological, however distressing. And so it can get kind of frustrating figuring out how we're supposed to express that to parties that are interested in diagnoses. Does that answer the question? Okay.
And someone else was asking, I'm going to pause the share because we can just, or I'm going to stop it actually just for now so that you and I can be on here. Someone else was asking, are having memorials and funerals helpful? So, I mean, I would say from my perspective, I think it can be helpful because it's a way to have a ritual around this experience. Not everybody wants it though.
Mm-hmm.
What do you think?
I think that's absolutely true, and it's going to, be one of the many areas where one size doesn't fit all. And so, for some people, it is very meaningful to have their loved ones there and have a tangible experience and honoring this baby, and that it can help create memories. It can be very important to the family history. And for others, for a wide variety of reasons, that might not fit, and that's fine. I think it's really important to, discuss options with people and see what fits, because there's nothing you should feel like you have to do to memorialize or to have a funeral. And the other piece I would add to that is it doesn't have to happen on a particular day. Sometimes people think, oh, well, I have to do something on the due date or the year anniversary, which might be very important. And if that doesn't work, that's okay too. You can do it on a different day.
Like you can do it, it may be you're not ready, right, in the weeks, months afterwards, but maybe you want to do it later and
Absolutely.
do it any time, and you can make it whatever you want to make it, really.
Mm-hmm.
Okay, we're gonna go on to, I'm gonna ask you some questions if you don't mind.
Okay.
So when we are looking at someone who's experienced a loss, and we have normal grief and trauma responses, what would you say are concerning signs for people to be aware of that are maybe atypical,
Mm-hmm.
or that's a sign for like you might need to get some extra help?
Yeah, sure. Well, I do want to start by just underlining what you said, that there are so many responses to grief that are very distressing, and they're going to make you feel like you're not your previous self, but that are within the range of normal. They would be expected because of all that you've gone through. And so certainly having a lot of issues with mood, some disturbances with eating, sleeping, work would be expected. And so just to underline that, and then to say, yeah, I think it is useful to know some things to look for. And in a general sense, I would say things that feel like they're very concerning to the person or the people around them, or things that go on for quite a long time. And let's go through some examples. So with eating or sleeping, of course, it would be normal to not be getting your best nutrition, to not be having the best nights of sleep. If it is the situation where you're not getting any sleep, or you do nothing but sleep, or you're really not eating even for a short period of time, I think that's a time to reach out and get some extra support about that. And if it's not that serious, but the days are turning into weeks where this is really still an issue, then again, I think it would be time. Another area I think about is the use of alcohol or other substances, which is a very understandable thing that some people turn to after loss. And if it is interfering with being able to feel, if it's to kind of numb out, or if it is causing its own negative feelings, which it can certainly do, that could be a time where you'd want to look at that and see what help you might need, if there's some kind of assessment you might need. And then it's pretty broad, and there are some of these things that you mentioned, Kylie, but if there are any symptoms that are really just distressing, scary to you or to your loved ones, and it could be a wide variety of things. It could be panic attacks or having frequent reliving of memories, having thoughts about hurting yourself or dying, or feeling like you really have absolutely no one in the world you can talk to. I think it's absolutely time to reach out and see what other support can be there for you. You might have other examples too, and I'm sure other people might have some ideas. The other thing I would add to that too, just because we're talking about what's concerning, is that you absolutely don't have to hit that threshold of concerning or dire to benefit from support. This is so hard for everyone. And so if you feel like, you're managing pretty well, things are going okay, but you would benefit from talking to someone, whether it's in a support group or individually or as a couple, I think there can be a lot to be gained in getting help, kind of processing your story and finding room for it in the bigger story of your life. And so it can be something that can make a real difference for people.
I mean, I think if you've been through a pregnancy or infant loss, you need to go talk to somebody. I mean, you need some type of support.
Mm-hmm. Mm-hmm.
It's so life-changing and traumatic that
I think it is life-changing and traumatic, and it certainly I think there's a lot of reasons. I also would say there are some people for whom it doesn't fit. And I always want to respect that too. There are people who are more active grievers, not such big talkers, who might be expressing it and working through it in their own way that maybe isn't as familiar to us, might look like they're minimizing it, but that might not be the case. I think it should be available for everyone. And again, like so many things, different things will fit depending on who you are and your circumstances.
So if someone is feeling that they want to get some help, where would you say people should start looking? What types of help can be helpful?
Right, because I guess we're talking about different kinds and different ways to access it. So if we're talking about talk therapy, one thing is to recognize that, again, could be different categories. It could be individually. It could be as a couple. Sometimes people want to be seen with their partner to have a place to process it together, as well as to work on what differences might be coming up and how they're grieving or what kinds of support they need. And it could be a support group, whether in person or online. So RTZ Hope has a list of providers in the different states. And so that would certainly be one place you could check. Your primary care might be a good person to check in with if you want to find out who might be covered by insurance in your area or get a personal recommendation that they might know. Hospitals often have support groups and they often have memorials. And so that's something that you might want to be aware of. And you all may know October is Pregnancy and Infant Loss Awareness Month. And so a lot of events happen during that time. As far as different kinds of support besides talk therapy, there's certainly people who find it useful to make use of complementary modes, whether it's meditation, yoga, acupuncture. And so I have respect for that, either being a primary treatment or an adjunct treatment during this time. And then I think a lot of things can be therapeutic that aren't, maybe labeled that way, right? Like exercise, walking in nature, talking to your best friend. So I think it's useful to remember there are a lot of tools and a lot of different levels of help. Sometimes reading about people's experiences can be useful too. Sometimes people really want to read about people who had something happen similar to them. So that too.
Thank you.
Mm-hmm.
So people are asking questions. I may
sure.
come back to the questions because they may veer us off. We'll deal with them in a minute. So looking at a parent's identity after a loss, right? Like you are a mother or a father when you have a baby, but if the baby's not alive, it complicates things, and society doesn't necessarily see you as that.
Yeah.
So you're confused about who you are. So how does your self-identity change after this loss?
It can be such a big deal. It can be such a shift. I mean, certainly being pregnant is a certain identity, and having a baby with you and being the parent is a certain identity. And so if you were just pregnant and now you're not, or your baby was just here and now they're not, that is a huge shift that among all the other experiences, it can confuse us with our identity and kind of shake things up in a very understandable way. And so sometimes what comes up for people is the question of, what am I? Am I a parent? Is that the right word? Am I a bereaved parent? Am I somebody who lived through a heartbreaking loss? And I don't have other words for it right now, which is fine. And I think it's important to just kind of acknowledge, because sometimes it takes some time of sitting with it to figure out what words are right for you, and to realize they don't have to be what anybody else assumes or thinks. There can be a lot of misconceptions about how people want to be seen after a pregnancy or infant loss. And I think it's very self-respecting to take some time to think about what it means to you and what words apply. And I think an associated and question that people often dread is being asked, how do you have children? Or how many children do you have? And again, it can be very hard to know what you want to say to somebody else. And the thing I tell people is you don't have to say the same thing to everybody. For some people, it's very important to say the same thing to everybody, and that's how they feel like they're honoring and respecting their baby, and that's fine. For some people, it feels like it is not worth my energy in the grocery store line, or that person may not be deserving of that information in the grocery store line. And I absolutely think that is appropriate too. So again, kind of sitting with what fits you. What words do you want to use to describe yourself and your family now?
Yeah, because not everybody deserves to hear your story.
No, I don't.
And you're not dishonoring your baby's memory by not saying that.
I think that's a really important point. And I think what's more important is what we know and what we tell ourselves.
Yeah.
Yeah.
So then looking a little bit at the parent's self-esteem after pregnancy and infant loss, how have you seen that impacted?
That is another area where things can feel very shaken up. Um, and I don't know if people read Michelle Obama's autobiography that came out a year or two ago, but she wrote in there about her miscarriage, which was really powerful for a lot of us that she would do that. And she wrote in there that miscarriage is demoralizing almost at a cellular level. And that word really stayed with me. And then more recently, the singer Halsey, I saw in an interview saying that she had had a miscarriage and that it was the most inadequate she ever felt was after having that. And for me, seeing these well-known people put the same words to these events that I've heard so many people say was really powerful. And I think says something about how shaken we can be that this part of our lives that maybe means more than anything can feel so out of our control. And to have an event be so upsetting and so out of our control is scary. And it can make us feel like it has something to do with us. Something about us isn't so good. It can bring up a lot of comparisons. Oh, well, it's easy for my sister or my best friend or everybody, my neighbors seem to be able to do this so much more easily. And I just really think when we can bring up some self-compassion, that this is a high needs time and try to meet those needs instead of beating up on ourselves for having had such a hard time is when we can start to make a difference. And it's nice for me to hear other people acknowledging it.
But there's also, I think what I've heard, there can be a lot of guilt.
Oh, yeah.
Like my body failed me, my body failed my baby.
Yeah. Yeah. Well, when it's in our body, it can feel like it's on our watch, right? And that can make us feel like we should and maybe do have more power than we do. We're the one that gets all the advice, what we're supposed to eat or not eat, or change the kitty litter or not. And the truth is, it's a fairly short list of what we can do. And there's a lot that is outside of our control. And so, and I think there are some cultural things about that too, that sometimes, people just expect that women during pregnancy have more power, control to make things go well than we actually do. And I think that fear of realizing how little control we have is part of it too. Sometimes it's easier to blame ourselves than to sit with the fact that there was nothing we could do.
It is a situation where we don't have control over. I mean, we can control a certain amount of things, but ultimately we don't have control.
Mm-hmm. Yeah. Yeah.
So I have some questions from people that are watching. And we can just chat about this. But Sarah is asking, in our society, we hear so much about the rainbow baby, baby who's born after the loss. But what happens if infertility follows pregnancy or infant loss? So it's like secondary infertility. And how can someone make sense of that ongoing loss?
Yeah, I think that is a powerful and poignant question and reality. And I think it's an important thing to address that after a pregnancy or infant loss, not everybody can, and some people may not actually want to have another pregnancy. And so for me, that is always a primary thing to keep in mind when people have this idea that that is the mode of healing. It can be a beautiful, wonderful part of your life. It is not going to undo what has already happened and the loss that you've experienced. And so I think it leaves us with the tools for healing that we have besides that, with processing the feelings we have, whatever the meaning that the experience has had for us, and looking at what our lives are like now. And there is going to be more life happening and more things to attach to it. I'm not saying things like, weighing that anything could be as significant as your baby, but just that things do change with time and how we understand our experience and what comes into our life moving forward. But you might have thoughts on this too. I'm not sure if I'm hitting all the parts of her question. Yeah.
I think that, I think one thing that I would say is that having that baby, which I mentioned before, doesn't replace the baby who's lost.
Mm-hmm.
And that there's always a hole in your heart for each baby that you have lost. Like, it will always feel like somebody is missing. And so, but I do think having infertility after a loss can compound that sense of loss. But I think what you said is true. It's like it's like you don't have certain control, and you have to make a meaning for yourself within the situation that you're in.
Yeah. And infertility, I think, can be viewed as a type of loss. There's a kind of a chronic pain in going through month after month without being able to conceive. It's got a lot of overlap. It's different, but I think, especially after a loss, it can bring up some of the same feelings.
So, Kayla is saying the only useful thing I have found is talking about it. Is that normal? And I would say it's normal for you. Like, what works for you works for you. And that, right? Like, it's your way of processing and grieving and healing is individual.
Yeah, I would agree. But I also think, there can be a real gift in being able to talk about it and knowing that that's what works for you. And then being able to go out in the world and find the right people to talk to about it. The people who are going to understand who you are, where you are, and accept and support that. So I think that's great.
Okay, and then we have a couple people asking about major differences between men and women grieving. So, and I will also add in there, if it's a miscarriage, when you're not even showing that, because someone is asking about that, like that the partner isn't necessarily moved or upset or affected by the miscarriage. Yeah, so I think, go ahead and answer, and I can.
Well, there's different parts to it, I think. So part of what I want to address is when you are the person who has been pregnant, that is just something to hold, that there is a concurrent experience emotionally and physically. And you did such a nice job laying that out before. But however a pregnancy ends, there's a hormonal shift. If the loss is at second trimester or later, there can be lactation issues. There's just so much that can be happening that can cause it's their own sensations and sometimes distress, and also be triggers looping back to the emotions of the whole process. As well as, kind of what we're talking about with sometimes the added guilt, this idea of, I should have been able to do something. This was me. This was part of me. And so that to me is maybe sometimes the bigger part to acknowledge as far as differences. Gender differences, I always want to be cautious, because you can have some generalities, but it's certainly not true all the time that male versus female are different as far as being more active grievers wanting to do things like build something or, um, you know, bring something home that's useful versus talking. That can actually be male or female or other gender. But I think what's to me the most important is acknowledging that there can be differences and figuring out how you're going to navigate those differences. To have respect of, okay, you're showing up really differently than I am in this experience, and how can we support what we each need with together and what we might need outside of the relationship.
Yeah, I mean, looking at it as that it's two separate people grieving
Mm-hmm.
in their own ways on their own timelines, and those are not always going to match up.
Yeah.
And then what I've heard is that, a lot of the times the spouse partner who is not pregnant, they will sometimes have delayed grief.
That's very true.
Like, hold it together for everybody and let the birth mom, have her like let her grieve, let all that. And they're also interacting between the birth mother and their family and friends. So they're having to stay pulled together a bit, and that their outward display of grief might be delayed. Not that they're not grieving, but they're just trying to hold it together.
I think that is very true, and that's a good point to remember. And that there might be other specifics to their experience that might take a while to understand, including if they were witnessing what was to them traumatic medical events, they had a different viewpoint. And sometimes their experience of feeling that, thinking about it, can come later. And people might be missing the experience of asking them about it. They might not feel as okay talking about how difficult that was for them, or how they might still be affected by it.
Okay, I'm going to do one final question, then we can just looking at somebody who's had the loss of a baby due to a medical termination of a pregnancy due to fetal anomaly, how can they kind of move past the stigma around abortion that's present in our society and be seen as someone who's lost a child?
That is such an important question, and I'm really glad that we are getting to the topic of termination for medical reasons, because I think it absolutely belongs in the world of baby loss. And as far as getting rid of the stigma, I mean, that's going to be a big job for all of us, but part of it is absolutely having these conversations and acknowledging that people are in an impossibly painful situation when they have a wanted baby and are given the diagnostic information that maybe there's a chromosomal issue that's incompatible with life, or the prognosis is so concerning that it leads them to make that decision to terminate. And how different that might be than what some people think of with terminations or abortions. And so I think having those stories out there matters. Having support for that matters. We're really lucky that in the San Francisco Bay Area, there's a group that's been going for 30 years called the Beyond Choice Group. And I have worked with so many people who've gotten so much out of that group. And there are some books and stories online, I think, that can help us feel like, it can help people feel like you're not alone. I wish there was more.
Yeah. I mean, I will say from my perspective, at our retreats, women who have terminated pregnancies for medical reasons are most welcome, and they come. Mm-hmm. And they are the same as everybody else, but I understand that, yeah, in our society, there is a stigma around abortion. But it's a societal issue that that society needs to be more open and understanding that this was not a choice. It is a wanted pregnancy, and they didn't, something is wrong and the baby's not going to live. So I think that, and though, it's like sharing stories and helping get through to those people to understand, but I think one person at a time.
Yeah, I agree. And just to say, I think it is important to hold a broader category of baby loss. A definition I like is anyone who's attached to a pregnancy or baby and is having to live without that pregnancy or baby. Because it is, I think, a broader issue. And there are people who have had adoption losses, or there are other people involved, sometimes surrogates or donors or extended family members. Sometimes I've worked with grandmothers whose daughters lost a baby. And so just to hold that it doesn't have to be this narrow definition.
Yeah. Thank you. I'm going to go ahead and put on the screen contact information with your email and your website if people want to reach out, and same with me. I will send out a recording of this to everyone who registered, and I'm going to try really hard to send out a PDF of the PowerPoint as well, just so people can look at that. But thank you so much, Donna.
Kylie, thank you so much for including me. I was honored to be here today.
Okay, I'm gonna share this really quickly if I can figure this out. I don't think it's gonna let me. So I made you host, and now it's like not.
Oh.
I don't know. Okay, well, I will email it out if you go in here. You know what I'm gonna do? I'll type it into the chat box right now. Okay. Oh no. Shoot, that was not what I wanted. I sent you a message privately, which is not really gonna do anything. Okay, hold on. Okay, so not cooperating. I'm just gonna put your website. I'm gonna put the Return to Zero Hope website up there. Okay, thank you everyone. Thank you, Donna.
Okay, thank you. Thank you all for your questions. Take care. Bye-bye.